In our prior videos, I stated that cholesterol can be reduced without medication. But there was one more thing I added in the video. In certain cases, we typically use cholesterol medication. Cholesterol medication is sometimes an alternative, but sometimes it is one of the medications that needs to be used continuously. Who should utilize cholesterol medication in this video? Set aside your prejudice against cholesterol medications and watch this video in an objective manner, without questioning whether you should utilize medications or not, or supporting either side. If you have one of the situations in the video, then it is time to start taking cholesterol medication. Cholesterol meds are widely used. These drugs have recently been the subject of serious speculation and are commonly prescribed worldwide. Actually, we've known these drugs for years. Since the 1950s, we began adding them to treat diseases routinely. Yes, these meds may have side effects. I'll address side effects in another video, but there's always a balance of risk and benefit for us. If the benefits of these drugs are very high and the risk is much lower compared to the benefit, we add these drugs to the treatment. But cholesterol meds are not like that. Doc, my cholesterol came out a bit high. It was slightly above the lab value. Should I start taking cholesterol medication right away? For us, what is important is the underlying diseases rather than your LDL, which we call bad cholesterol. Cholesterol meds aren't cookies. It's not self-cuttable like a cookie, but a doctor-prescribed medicine that shouldn't be taken lightly. Yes, these drugs have been widely discussed, but in this video, I have gathered all the scientific evidence about cholesterol medications. And who do we start the cholesterol medication on? Who are we not starting with? I mentioned this. So, while contemplating whether you have the diseases and conditions I will inform you in a moment, it signifies that we typically prescribe these medications for you by merging the side effect and the effect without disregarding either. So, we oppose these drugs and do not support their use. Our stance is that they should only be used appropriately in the right time and place. The primary indication of cholesterol medications is heart and vascular diseases. If you have heart and vascular disease, if you have plaque in your arteries, if you have a stent, if you have had a bypass surgery on your main artery, heart artery, leg arteries, kidney artery, or if a stent has been placed in any way due to a blocked artery, or if you have had surgery, in such cases, regardless of your underlying LDL level, even if your cholesterol is not high, we add statin to the treatment. You often ask this here, can't I lose this with a diet, teacher? Yes, you can lose some weight with a diet. But the reason we prescribe these medications here is not solely to lower LDL, but these medications have effects that reduce the risk of plaque rupture, that is the tearing of the plaque. So when you have cardiovascular disease, even if your LDL level is not very high, we usually add them to the treatment. Let's go through an example scenario. The person is 45 years old and having a heart attack at age 45. For instance, the LDL was 115 during his heart attack. Our LDL upper limit is 120, the normal upper limit. Statins are usually added to this person's treatment because the reason for this person's crisis is the rupture of the plaques in their veins, not the growth of the plates. And remember, in 2 out of 3 patients experiencing a crisis, cholesterol levels are normal. In other words, cholesterol is not the only cause. Drugs for cholesterol are called cholesterol meds, and we often refer to them as statins. In other words, statins do more than just lower LDL, they specifically target bad cholesterol. These drugs protect the stents. These medications protect your bypass vessels, prevent plaque growth, and reduce the risk of heart attack. The most frequent cause of a heart attack is not the growth of plaques, but the rupture of plaques, and this can occur abruptly. And these drugs have the ability to stabilize the plate, and we have pleiotropic effects on this. If a person has a heart attack, the studies show it. When one group of patients who had a heart attack used statins and the other group did not use them at all, the group that used statins, I'm saying regardless of LDL levels. In other words, regardless of high cholesterol, the group using statins has lower risk of heart attack compared to the group not using them. In other words, statins are one of the medications that decrease the risk of premature death if you have a cardiovascular condition. Yes, these medications can have adverse effects, and we do not overlook or dismiss these side effects. Side effect. We provide considering the risk-benefit balance. If you have cardiovascular disease, statin is typically added to the treatment, I can state. 2. Coming up next are individuals with persistently high LDL cholesterol levels that are above 190. LDL cholesterol is not a type of cholesterol that responds well to lifestyle changes. For example, triglyceride responds very well, but LDL cholesterol generally changes by about 10–20% with lifestyle changes, and the most common cause of high LDL is genetic. The person in front of us is 35 and 40 years old with an LDL level of 250. Regardless of their lifestyle and efforts to limit saturated fats, the LDL level remains high. Eliminate as many eggs as you desire from your existence. LDL level will never decrease below 150–120. Because the underlying reason is genetic. Regardless of what a person eats or drinks, the liver produces LDL cholesterol at a very high level. And we call this genetic high LDL cholesterol. If LDL cholesterol level is still persistently above 190, despite lifestyle changes after the age of 30, statin is usually added to the treatment. Look, you're watching me now. I'll try to bring this down without meds. I hear you saying you don't want to use these meds because they say this and that about them. I have no concerns about these medications. I don't have a problem defending these medications. But I'm a doctor who experienced a heart attack at 13. I'm a doctor who's seen children undergoing bypass surgery at 9 due to artery blockage. In other words, genetic high cholesterol levels are not a speculation. Genetically, LDL can really reach very high levels, and this can truly put us in danger. If we have persistent genetic high cholesterol, do not hesitate to seek assistance from medications at this location. Because we really don't want you to have a heart attack at a young age. Diabetics are in third place. Meds can slightly increase blood sugar. If you have high blood sugar and haven't been diagnosed with diabetes yet, it's good to make lifestyle changes and get rid of diabetes quickly. When diagnosed with diabetes, if diagnosed for over 10 years, the risk of cardiovascular disease significantly increases. If someone has had diabetes for a long time, in such cases, we want to keep the LDL level below 100 or 70. Our main goal is not to suppress LDL severely, but to protect the arteries. In other words, is to safeguard our main artery, the Shah artery, and our heart artery, most affected by diabetes. To protect our leg veins. If you have been a diabetic for many years and if your LDL level is above 100, then adding cholesterol medication, namely statin, to the treatment can be considered. At times we can select alternative meds for high triglyceride levels, which is a type of blood lipid. I'll explain it in another video. Triglyceride isn't cholesterol, and the meds prescribed for high triglyceride levels aren't cholesterol meds called statins. I'll explain it in another video, but the topic of this video was the cholesterol drugs called statins. Well, sir, I had some problems under the statue. Liver damage has developed. Yes, there is a 2% risk. But this is not a situation we rarely see, so it's not a situation that often causes harm to the liver. Actually, a very rare side effect. But if we still have a side effect on the liver, if we have a side effect on our muscles, we change the treatment. In such cases, we can opt for alternative cholesterol meds. There are even cholesterol meds available in injectable form, not taken orally, with minimal risk of side effects. Please inquire with your doctor to find the best cholesterol medication for you. Inquire with your doctor. It'll provide excellent answers. Don't take cholesterol meds on your own. Do not stop taking the meds we've given you without consulting us. We do not have any concern regarding the defense or opposition of these medications. Our sole and exclusive concern is your health, the health of your veins. I know that these medications are subject to speculation and should be used only when necessary. These drugs have high scientific evidence, especially cardiovascular disease, carotid artery disease. It is one of the highly beneficial drugs in a group of patients diagnosed with a disease. Subscribe to our channel, turn on notifications for our other videos about heart and vascular diseases. Goodbye.